Here's another health tip I learned from being a medical malpractice attorney. When is it okay to speak up in a hospital? Now, we all can agree hospitals are extremely important. They do great things. They're very busy places. But we all can also agree that hospitals can be very intimidating. You don't know where you are, you don't know where you're going, and it's a very stressful situation because obviously you're there because you're in pain, you need help, or one of your loved ones is there needing help, is stressed and is compromised. And so this is all a very chaotic and intimidating environment. So there are situations where you're not sure what to do, what's going on, and you can feel absolutely intimidated. And sometimes people are afraid to actually speak up because they think, well, the doctors know more than I do. What do I know? And that's okay. But when should you speak up? Well, first, when you see a change in yourself, or if you're with a loved one, if you see that something's changed. So now all of a sudden they were in for some surgery and they're feeling a new pain in a new place. What's that all about? Or if more serious things happen where they're not breathing right, or there's a new weakness, or there's a new symptom like they all of a sudden can't urinate, or if they seem like they have a fever, or now they're bleeding from somewhere, or that they're complaining of a sore of some sort on their body because they're not being moved or rotated. So you have to look out for yourself or your loved one and report these symptoms, report what's going on. And I would also urge you to write down the questions or to put in your phone in a note. What are the questions? What are the things you're seeing? What are the questions you have for the doctor, for the nurses, for anybody, so you don't forget? The best patients in a hospital are not the quiet ones. The best patients are the informed ones, the most informed ones. And you want to be that. You want to be informed. You want to know what's going on. You want to ask the questions. You are an important part of your own healthcare or your loved ones. You're part of the process. You're going to be noticing things that these doctors don't. You know these people. You have to speak up for them, speak up for yourself, and if something seems off, say something.